Hey everybody, it's Eric with Motion Guidance, and thank you for joining me today. The topic for today is Hey everybody, good morning. This is Eric with Motion Guidance. Thanks for joining me today on the live stream with a topic on lower extremity applications and squats, as well as some post-operative rehab considerations. If you've been following us on social media, our Instagram, Facebook, Twitter accounts at Motion Guidance is our handle. You've been seeing some increased traffic this week on two specific applications, one for baseball, and some feedback for sporting applications, as well as some things for Parkinsonian considerations. So those things have been great to see from around the world. So if you're not following us on social media, make sure to check those out this week. For this live stream, what I've done is I've created some pre-made videos that we'll be watching for the applications around the knee. The original genesis of the motion guidance system was actually created for the knee in ways that you could attach the laser pointer onto the lower leg and make sure that you could get visual feedback during squatting. As we all probably know, things like squatting and lunging can be difficult if you have pain or you're going through rehabilitation for a chronic condition or a post-operative condition. So being able to see the subtle movements of squatting with varus and valgus and get a good feedback on balance compared to the other side can be super important. So we wanted to take this opportunity to give you some feedback on how to apply the motion guidance system for visual feedback during these patients, and hopefully give you some good cues for home. And as always, ensure that if your patient needs these resources for home, you can give them a patient pack or send them to the website to get a patient pack so they can continue on their rehab. We will have our discount code for those who stay throughout the whole live stream at the end. And that'll be good for the next 2 weeks. So you'll be able to get some discounted merchandise on our website at motionguidance.com. So stick around for that till the end, and I'll give that out. And I plan on this one being about 30 minutes, so it's going to be a little bit longer stream. After we watch the first video, we will have a little come back together, and I'll open up the chats, and we'll see if there are any good questions at that point that we can discuss before we get on to the second video. So the first video is going to be on kind of phase one. Is what we are going to refer to on this one for knee conditions, someone who's acutely swollen and they're just trying to turn their quad on, someone who's trying to gain terminal extension, someone who's post-operative and they're trying to get some sensory feedback on how to improve that lower extremity function to get range of motion, and how to progress those through things like a short arc quad or a leg raise. And then the second video will be geared more toward the squatting applications that you can use with the clinician kit as well as the patient pack. So let me share my screen. So give me a second to get that up, and then we will watch the first video together. All right. Here we go. So let's bring this up and let's take a listen to this video. Hey everybody, it's Eric with Motion Guidance, and thank you for joining me today. The topic for today is how to utilize the motion guidance device at the knee to pick up on deficits in quadriceps function. And this is mostly relevant for post-operative conditions like total knee arthroplasty, general arthroscopy, ACL reconstruction, meniscus conditions, or just contusion with some acute swelling or effusion around the area. This was brought up online with some questions with some of our viewers after we did some of the cheaters videos for the head neck area recently, and how to pick up on things that you can't necessarily see with the naked eye in clinic to help our clinicians diagnose and treat better, but also to help your patients recognize what their deficit is so they can maximize their performance not only in clinic, but then utilize the home exercise program packs that we have with motion guidance so they can continue on at home in between sessions. So for this application, you'll need the knee strap that comes with the clinician kit. Remember, all of our straps have the hygienic backing on them, which makes them stick and not migrate on clothing, but you can put them directly on the skin and then wipe them off afterwards. A nice hygienic option there. In the clinician kit itself, this would be the second largest strap in that pack. We also have the home exercise program pack with the knee strap that comes with one individual strap and then the other components. We also want to use the flat mount today, not the perpendicular one, but the flat mount. You can kind of see that there. And then the rechargeable green laser comes into the patient pack automatically. So you can see how that shines out there with the green. All right, very easy to see. So we're going to place this at the knee, and we're going to go over a few different options. But first, I want to talk about the common deficits that we see just with quad setting and terminal knee extension. So one of the main focuses for things like total knee arthroplasty is getting that terminal extension, but getting it with the quadricep actively to make sure that we gain it. A common thing that we see in clinic is patients can contract their quad, but they're not actually gaining terminal knee extension. And then when they're in pain and they're resting at home and maybe not as diligent with their home program, or they're just not understanding what they're supposed to be doing, they end up getting that flexion contracture and losing extension, which of course affects gait, can produce anterior knee pain, posterior or lateral knee pain, and alter back mechanics, hip mechanics, things like that. So it could move all the way up the chain. So we want to make sure that we get that terminal knee extension as soon as possible after surgery, but also to keep it, right? That's going to be part of the goal early on in our phase 1 type of rehab. The other things that we can see as far as cheating or dysfunction is the patient will get a co-contraction. So they'll tighten up the quadriceps and the hamstring at the same time, and they'll tighten up in through their quad, and you can see that kneecap kind of tighten up, but they actually aren't dropping down into extension. So that's a common cheater that they'll have in gaining their extension. You'll also get dysfunctional firing of the quadriceps, and they'll actually substitute with their hips. So they'll start pushing down through the hip, and the quadriceps is actually fairly ineffective or inefficient in that position. And you can easily see that by just moving their kneecap side to side. And when they say they're contracting, if I throw my leg up here real quick, hey, I'm tightening up and I'm pushing down, but actually they're just doing it from the hip, and you can just move that kneecap all over the place. I call it the patellar wiggle sign in my clinic, okay? So they have a positive patellar wiggle sign, they can move that around, and it's just showing that they are inefficient with their quadriceps. So that's something that I like to utilize. Also, getting an extensor lag, so as they start to lift their leg during a short arc quad, long arc quad, straight leg raise, some open chain options. They will have a drop of their foot as they start to lift their leg, and that's called quadriceps extension lag. And they're not maintaining that full terminal knee extension throughout their exercise. One reason I still like to incorporate open chain kinetic exercise with this population, as well as some closed chain options, is that closed chain, you don't have to get that terminal knee extension pushing all the way back in stance while they're functioning. So it can be good through squatting type activities, step up type activities to get that closed chain function of their knee, but they're not gaining that terminal knee extension oftentimes in those exercises either. So let's apply the motion guidance device to the knee, and let's see how these will present while you're in clinic. All right, I'm going to slide my shoe off for this, similar to what you'll have in the patients post-operatively, and there's some markers on the sock that I'm going to utilize for this particular tutorial. So to put this on, okay, if I get up here, I'm going to get to the top of the kneecap, and I'm going to have a 3-finger width or maybe a 4-finger width above that I want to put the strap. Now, this is just to help me standardize for everybody where I'm going to put it. All right, this doesn't have to be a particular distance, but we do want it on the thigh, not right across the kneecap. And I'm going to just adjust this to where the blue field is pretty much on top of the thigh here and above the kneecap. I'm going to take that flat mount, and I'm going to slide it into the blue field. I'm going to tip that laser to the side and project that down toward the toe. Now let's go over these one by one, why this is important, okay? Utilizing the motion guidance device early on to establish quadriceps function. So if I project the laser down toward the toe, and you guys can see that there, if I do a co-contraction, well, let me back up a second. Let's take a look at normal, okay? And then we'll take a look at the dysfunctional things. If I tighten up my quadricep and it drives me into terminal knee extension, I'm going to see the laser move down on my foot because the heel should be rising up. That's going to be typical extension. So the shank starts to rise up as the quadriceps pushes down. The terminal knee extension or the screw home mechanism is locked in by the femoral condyles onto the tibia. And you'll see that action as normal quadriceps function. Okay. This is in contrast to what we still do, and if I might take a little bit of liberty here, for I don't know what reason, we still are pushing down on total knees initially as they come out of surgery in the subacute phase and the acute phase. It's not the same mechanism just to push down on both sides of the knee. It oftentimes is just painful and reinforces the lack of gaining extension for the patient, and it doesn't promote quadriceps function, which is actually going to gain terminal knee extension. Okay, so let's not do that anymore. It's definitely not built around scar tissue. It's built around contraction and fear. So let's just stop doing that and show people how to fire their quad and then work on other forms of terminal knee extension, maybe manually or with them at home, okay? So if I go through back on track here, a co-contraction. So if this is normal and I tighten up my quad and the laser moves down on my foot, a co-contraction would do this. So I've contracted my quad and I've co-contracted my hamstring or part of my posterior aspect of my leg, and the laser's not going to move. Okay. Oftentimes these patients, as the laser doesn't move and you start to show them quadriceps function, then they become quadriceps inefficient because in order to put their leg down, they don't tighten up their quad then. So they were co-contracting and now they don't understand how to just tighten up their quad and relax their hamstring. Okay, so watch for that laser not to move in this case as they tighten up their quad. So the wiggle test is now negative. Okay, you can't move that thing around. You know they're getting a good quadriceps function, but they're not getting quadriceps function to gain terminal knee extension. Okay, that's important. The next one would be they just push down with their leg in their posterior element. They have a positive wiggle test, so their quad's inefficient and they're just pushing down from their hip. That laser's also not going to move. It's not going to move because the shank is not going to be able to rise up into terminal knee extension as you get the screw home mechanism. So they push down and they're pushing down real hard with that posterior element, and they're just driving that hip into the leg, into the table. They're driving that heel into the table. Their kneecap's swimming around there, but the laser's not dropping down. Okay? So that's going to also tell you what's going on there based on just a few easy objective diagnostics. All right. Now the next one that I mentioned is going to be that extension lag, quadriceps extension lag. So if they can start to tighten their quad and that laser moves down, I can give them some encouragement. Hey, can you move it down to the very last line on your sock? Really tighten up, squeeze, squeeze, squeeze. There you go. You finally got it. Tighten, keep going, keep going, keep going. And you can do that with their shoelaces. You can do that just on their foot. You can draw a line on there, okay, and work that exercise over and over to really gain terminal knee extension with their quad actually firing and moving the laser. Now, when they start to progress to like a straight leg raise, okay, and commonly we'll put them in full supine or we'll put them onto the table in this sort of position, in a half hook lying position, they're going to tighten their quad and then they're going to lift their leg and they're going to lose full terminal extension, and that laser is going to end up being on the wall. And you can see that in the video. Okay, so they go to tighten up and push down. Now the laser's on the sock, and they go to lift up and they lose it. So many of my patients can't feel that difference because their goal is what? Just to lift the leg, right? So they lost the initial quadriceps contraction and it popped onto the wall. So I need them to focus on whatever it takes to keep that laser on their foot. Really give good effort and hold that on the foot all the way up and all the way down. I'll see this a lot also. They finally get good at holding it, and then when it comes back down, they lose it, right? But that's going to be a visual reinforcement of their quadriceps inefficiency and lack of maintaining terminal knee extension, and that's what they can feel and see at the same time, and that's the positive for not only in clinic but for home, because they'll gain a memory of what it should be like, the effort that it takes to maintain that when you have an inefficient quad, maybe some effusion, definitely pain. Any of those things can cause inefficiency, all right? So you push down, you go to lift up, oh, and that laser leaves, and they're going to be trying to maintain that on the foot. Now, as a clinician, you can also give them goals. Maybe I'm going to put this further down my foot to make sure that they're getting successful reps of maintaining it on the foot. And then the better they get, I actually put it off the foot to start, push down onto the foot with contraction, and maintain that on the foot to lift. So you can create your own standard deviation with this particular activity with your patient, okay? And that's going to be great for them for feedback, all right? Now you can also do this with short arc quad. Now I'm going to come out of the frame here for a second and gain a ball that we commonly use for short arc quad here at my clinic. And I'm going to do the same exact thing. I'm going to put this on the wall, and I'm going to have them kick up trying to chase the laser with their foot. So that's true terminal extension. And what do we see a lot of? We see a lot of, hey, I'm extending, but I'm short. I can't quite get to the laser. Or I kick up this much, and then I try to lift off the ball because they're, once again, not gaining that terminal knee extension. We need to get them to chase that laser, keep getting terminal knee extension, and then maximize the length or the distance of the laser onto the foot. Pull that toe back at the end to pull on that calf and help drive that knee into extension and hold. Can I get that laser onto my pair of jeans here? Oh, yeah, if I get that terminal knee extension, I can. Okay? And that's the external focus of attention. Not on the knee, of the laser moving onto the leg. Okay? So the focus is down there, not here. We're likely going to gain some performance and some memory of how to do that with repetitions. And then as a clinician, you can decide, do I want to do numerous repetitions of this? Do I want to do 3 groups of 10? Do I want to just do a few? Do I want to spend several minutes here? Because it's that critical early on. All right. So those are several applications for the motion guidance device at the knee, likely for post-operative conditions. And I really want you to investigate this in your clinic if you have a device. If you don't have a device, obviously go get one. This is going to really eliminate a lot of the early deficits that you see with post-operative conditions. This is going to really help train completely your patient so that they don't have that extension problem and gain that quad function early on, and then it's all uphill from there as far as progress goes. All right, downhill for difficulty. If you have any comments, leave them at the bottom. We'd love to engage with you. Otherwise, have a fantastic day. I'm Eric. All right. So there was our first video reviewing some of the applications that we can use around the knee for that early onset of trying to gain terminal extension, trying to get people to utilize that visual feedback to emphasize their quad function and just get a good understanding of what they're doing. And this should carry over to home pretty well for them to understand what they're feeling as they're seeing it and make sure that between visits they're maximizing their range of motion, their quad function. So let's take a second. If you have any questions or comments that you want to throw up into the chat, I'll give a minute for that, and then we'll move on to the video regarding squat progression. All right. I'll let you finish that if you have anything to throw up in the chat. So let's move on to the next video. All right, so I'm going to start screen sharing again. So give me 1 second to get this one loaded. And we'll get out of these things, make our way over to this one. And I'll forward on to this area here. So we're going to start in with the squat application. This was using our patient pack model. All right, so just about 5 minutes left in this video. A couple times a day. All right, terminal knee extensions. Now for further progressions, you can work on squatting with the motion guidance device, and that's where we're going to start using the flag. So I'm going to put my painful or involved leg at the center line of this flag that's laid out on the floor here. Now, if I don't have a painful or involved side or both sides hurt, I can always do this on both sides differently, okay? So what we're going to work on is I'm going to get that laser projected out onto the flag on that center line, and then I'm going to go through a squat. There's a couple things to look at with the laser on your squat using this system. So as you start to squat down, if that laser is not moving further away on the flag where you can get it off the flag during your squat, you're likely having too much knee flexion during your bend. In order to try to correct that, we suggest getting your hips back and getting that laser to project out all the way past the end of the flag, promoting a hip back, shoulder forward squat. Now, you can always do repetitions of a shallow knee squat if you need that type of strength for something specific like going downstairs. But if you're working on squatting and getting up from a chair, okay, or building strength through those legs, we want to try to project that laser out to the end of the flag. Once you've perfected that, you can work on precision and try to keep the laser on the lines of the flag all the way down. And you can work on all three lines on the flag, inside, middle, and outside. All right? Try each one of those 10 times, or maybe even progressing to getting tired or fatigued. 3 different groups, a couple times a day. Now, if your pain is getting worse with those, we recommend you stop and you consult a healthcare provider. All right? Now, other options. We can start moving the hip and the leg during your squat to start becoming more dynamic in your muscle control and your strength. So as I start to squat down here and I get to the first line on the flag, I can move the laser out or in and then come back up. I can then progress to the next line, go out, go in to the targets, and then come back up. Go to the last line, go out, go in, and then come back up.
If you want a real challenge, you'll do each line out and in, not coming back up, and then progressing further down in your squat. If you're advancing with this activity, you can even go where the line is, or the laser, is on the end of the flag, go out, go in, and then come back up. Get a nice fatigue on that leg. All right. For further advancements, you can start working into a little bit of a lunge where you might step back with the other leg, project that laser out down the lines of the flag, focusing on precision, keeping it on the line, both out and back up, performing a lunge. You can utilize all the lines on the flag or get creative and make your own lines. And of course, you can do these for repetitions, 3 groups of 10, or go until you start getting fatigued. I can even go through some of these targets toward the outside, go through some of these targets toward the inside. Okay? And of course, you can progress through full ranges of motion where the laser isn't even on the flag anymore. All right? Now, finally, we can progress to single leg activities. So lifting up the opposite leg and performing the same activities, but on one leg. A regular squat, squat with precision, utilizing all the lines on the flag, or a single leg squat, moving the laser back and forth. Out, in, and back up. Feeling the burn. Down to the next line, out, in, and back up. Progressing through with numerous repetitions, as mentioned before, either 3 groups of 10 or until you get tired through that leg. We hope you find value in these, and check out motionguidance.com for more information. Thanks a lot.
All right, guys. Great. All right. So there's some simple progressions that you can go through as a clinician with your patient, and you'll start picking up on some easy observable things to give you insight into control left versus right or involved versus not, working on the depth of squat. And one of the other benefits of having the immediate visual feedback is essentially having a coach the whole time. So as the patient's going through these exercises, you can start moving away. You can tell them to do certain groups and sets and reps with these things, and they can start seeing their performance even improve or degrade over time, depending on their amount of fatigue that they're getting or the amount of control that they're gaining through the repetitions of the exercise. The motion guidance device, as an extra add-on that we haven't talked about yet today, also allows for dynamic motion. So the ball and socket joint is designed to be stable enough to where you can do these similar things with the flag or without, but during jumping. So things like a single leg hop for distance, a triple hop, simple jump training with landing with control on both legs with one leg. The visual feedback can be quite impressive to help them learn, especially if you add it on as delayed feedback where you get your phone out or any video system and you record them doing this, and you can go back in slow motion. You can stop with certain repetitions and show them what they're doing. That can replace a very expensive video kit that you might need for in a clinic to get multidimensional feedback for people. So consider that in your clinic as well. So that's all the content for today. I still have the chat open if anybody has any comments or questions, and I'll give that a moment if people want to ask. And then I'll give you today's discount code for 10% off merchandise at motionguidance.com. All right, looks like everybody's pretty content with today's content. So that code is going to be knee MG. KNEE. MG is in Motion Guidance. You put that in as a coupon code at motionguidance.com. You'll get 10% off your merchandise. And don't forget to follow us on our newsletter from that site, which we send out notices, as well as our social media page on the upcoming live stream. And look forward to seeing you on our next stream. Have a great day, guys. Take care.